Good afternoon, everyone, and welcome. Thank you for joining us today for this important conversation. My name is Adam Odesser. I'm the director of the Dr. Stuart Lessons Israel Action Center at the Jewish Community Relations Council of Greater Washington. At the JCRC, we work tirelessly to educate our community and strengthen the support for Israel and deepening the understanding of the complexities of the region and foster meaningful conversations and relationships across communities. As many of you know, today's webinar is part of JCRC's new initiative, the Greater Washington Partners for Peace, which seeks to highlight organizations working to build a more hopeful and peaceful future for Israelis and Palestinians. One of our guiding principles of Partners for Peace is that even in times of conflict, there are individuals and organizations who refuse to give up on cooperation, on human dignity, and the possibility for a better future. They understand that building trust and improving lives, even during challenging times, is essential in order to maintain the hope for a more peaceful future. Today's program highlights one of those organizations that we at the JCRC are partnering with through the Partners for Peace initiative. Rozana, formerly known as Project Rozana, is an organization that demonstrates how healthcare can serve as a bridge between people by creating opportunities for cooperation and saving lives regardless of politics, nationality, or religion. And at a time when headlines often focus on division and conflict, it is important to also learn about those who are working on the ground to address urgent humanitarian needs while building relationships across different communities. So with that, it's my pleasure here to introduce our speakers for our conversation today. We have Ran Goldstein, who is the global CEO of Rozana. Ran brings extensive experience in humanitarian work, civil society leadership, human rights advocacy, and health diplomacy. Before joining Rozana, he served as IsraAID's humanitarian representative in Washington, D.C., and previously he led Physicians for Human Rights Israel for 8 years. Throughout his career, he has worked at the intersection of healthcare, public policy, communications, and Israeli-Palestinian engagement. He is helping advance initiatives that seek to improve lives to strengthen cooperation across different divides. Joining Ran, we have Muhammad Asideh. Muhammad is the Executive Director of the Palestinian Office and Director of Advocacy at Rozana. Muhammad brings significant experience in public policy, communications, and program management after working across the Middle East, Australia, Singapore, and the United States. Prior to his time at Rozana, he served as Policy and Communications Director at Zimam, an organization dedicated to strengthening democratic engagement and civic participation among Palestinians across the West Bank, Gaza, and East Jerusalem. His work has focused on building partnerships, advancing policy initiatives, and creating opportunities for cooperation and dialogue. So, Ran, Muhammad, thank you both for being here with us today. Before we begin, I will note that this conversation today is being recorded, and we will also take questions later. So if anyone has a question in the audience, please feel free to submit those through the Q&A feature, and we will get to as many as we can later on in the program. So with that, I want to begin with you, Ran, and kind of set the stage for the audience here. Can you start by telling us a little bit about Rozana, its mission, and how the organization came to be, and what role do you believe that healthcare plays in building connections and improving the lives of both Israelis and Palestinians?
Yes, thank you, Adam. Thank you, everyone, for joining us. Rozana brings medical teams to work together from both sides of a conflict. We do both, we believe that health, it's a bridge for peace. We believe that health is a common language. So people, even if they work from different background, they still have the same understanding of what they need to do when they treat people, when they train people. And we believe that this working together, the ability to have a common interest, bring people more closely to actually understanding and better understanding that they can live together and contributing to peace. We also do more, since October 7, more humanitarian work, and Muhammad can elaborate about what we do in Gaza nowadays and what we do also in the West Bank in our project. But I do want to say that for us, it's always important to keep the cross-border component in our projects. And even in the worst times, Adam, what you described, living in Israel, being in more the liberal, lefty, progressive, whatever you call it, side of the political map, it's not easy to wake up to the news or to wake up to our government nowadays. And I must say that joining Rozana, and I'm new to Rozana, I just joined in last September. Joining Rozana last September actually bring me a lot of hope when I wake up every morning to walk with people, and I see how we can walk together, how Rozana bring, not only cure to people in needs, but also actually more development, more strengthening the capacity in both sides, not only the Palestinian side, because I think nowadays it's very, very important to show Israelis that actually there is partner for peace. It's not less important than strengthening the capacity of some hospital in the Palestinian side to build a new oncologic center. It's important, but also important to keep this discussion inside Israel and promote and expand those people who now need to kind of renew their imagination and get again the belief that peace is possible. So that's Rozana. That's what we bring, and to see, for example, young women from East Jerusalem now sitting together with women from West Jerusalem, Jewish and Arab, training to be an ambulance drivers with the MDA. It's something that, after October 7, I think it's kind of a miracle to see it happening. And this group of women that never didn't knew each other before, some of them didn't speak Hebrew before, and with our training now they do speak Hebrew. With the help of the MDA, they will, one day will be ambulance drivers, and to see them becoming friends, which some of them never crossed from East Jerusalem to West Jerusalem before, and obviously the Jewish never came across Palestinians from East Jerusalem before, really to be really in real discussions. This is Rozana. This is what we do. This is what we bring to the table. And I'm very proud to lead this organization in these difficult times.
Thank you, Lon. And I know you mentioned you joined just this last September, and maybe you could address it, or Mohammed can address it as well. But maybe can you just maybe talk a little bit about how the work has changed over the last few years with October 7th, maybe over the last year, just having a peace deal in place, or so-called peace agreement, or some ceasefire agreement. How has that changed your work in terms of working inside Gaza or with Palestinian communities in the West Bank as well?
So maybe I'll start, and Mohammed can obviously complete my answer because he was there during the time in Rozana. There are different challenges during the last 2 years. One of them is obviously the war, which put us in a position that we didn't plan to be, but now we have clinics in Gaza operating by Rozana staff, by doctor, nurses, and medical team in Gaza, which was not the plan. The plan was to be working with medical teams from both sides and not actually treating people. But that's the situation in Gaza. And since we have the possibility to employ people in Gaza, we thought, okay, this is something that's important that we're going to do. Another challenge was that the new administration in the U.S. decided to demolish USAID and the MEPA programs, and Rozana was one of those organizations here who implemented big program of USAID. And despite all those challenges, we never stopped working for a second. Even during the war, we still brought in a special program of nurses, nursing hub, as we call it, from both sides to continue and have this dialogue and work together. So, as other NGOs, the needs are enormous now in the field. So, yeah, there are challenges. The situation is really, really tragic for many people in both sides. But for us, unfortunately, as an NGO, we have more work to do. So I think Muhammad, when I joined, and it was not so long ago, we had like 10 people. Now we're around 40 people. So you can understand how fast and
45.
40, 45.
45.
Yep.
45, you say, is more in the details because they pay them in the end of the day.
Exactly.
So most of them work in the Palestinian side. Uh, so that was a change. And also, I can say something about the atmosphere in Israeli hospitals, which I never thought it will be the situation. So some testimonies we heard from people that, coming to do shifts together, Jewish medical employee together with a Muslim one, and doesn't want to work together. Some of the testimonies we got from some of the hospitals is that we don't really want to work in the same shifts. And the fact that we were able to implement a program in one of the hospitals in the north of Israel, actually about this dialogue, to strengthen the relations there and to prevent the next time when something happened, to prevent the situation from happening, that's also something that we're due. So, and I think the war brought it really, to the table, very straight. It was always there under the surface. I think the tension, but now in some hospitals, and I hope we will be able to do it in more hospitals, to bring this dialogue and the real narrative of both sides with what they feel when the war happening, it's really important to stabilize the system. And Muhammad obviously have more
Yeah.
experience than me.
Yeah. Yeah, well, thank you, Juan, for giving us a little bit of this overview of Rozana's mission and a little bit about the work. And I want to turn it over to Muhammad. And Muhammad, of course, you can talk a little bit about that as well. I also want to add in, from your perspective, also Director of Advocacy, how, what makes Rozana's work or approach very unique, and what is the impact that you have seen over the past few years from the healthcare initiatives that you guys have been running, in the different areas that you operate?
Sure. Adam, thanks so much for having us today and for organizing this event. And apologies for the long bio. I didn't know you would read all of that. So next time I'll make sure it's shorter.
You have a lot of
Naturally,
great.
I have a humble experience still learning, and you can see Ran is very humble today on the call as well, which is I think there are a few things I have been advocating for the two-state solution and an end to the Israeli military occupation and establishing lasting peace almost all of my career. I mean, it started as activism and it continues until today, whether I'm working for an organization in the field or not. I've been always part of this activism. And to be frank, I think activism is great, comes with good intentions, but without a plan, without a strategy, it doesn't lead to much. And from my previous experience, there was this frustration that we always meet for dialogue, to discuss narratives and trying to come up with one understanding, one narrative, as if there are no problems, and assuming that to reach an end to the conflict, you must have peace first. And I think the approach of Rozana is, and other organizations who are following a policy approach to the conflict, trying to do something practical, where you would see the work that Ran described in Gaza now, where we have field clinics, rehabilitation clinic, an office, and more than 30 staff members in Gaza now on the ground from the displaced community. And we're doing that in cooperation with Israel, which is an Israeli organization. But they're very close to us also in the way we view the political situation and the end to the conflict, which is also establishing an independent Palestinian state next to Israel. So we agree on that general picture, and we've been able to work together and make an impact and make a difference, even though we don't agree necessarily on the same narrative. I mean, even among Palestinians, there will always be differences among the Israelis on how you view things and why things happen and why things didn't happen. Why Camp David failed, for example, in Palestine. There's always arguments over this. And at some point, I also realized that the more you're trying to have the same narrative and the same understanding, the further apart the parties become. I mean, the worst thing in the world I could do is try to convince my wife why it's okay for me to go inside the home wearing my shoes, for example. Why it's okay to throw my jacket on the couch. I mean, that's my narrative. That's how I lived most of my single life. But now things are different. So what I do now is, I do whatever she wants, basically. But I think, and there are things that are the other way around, which we do view differently, and we live in peace despite those differences. Sometimes really trying to change the narrative and trying to reach one narrative for the conflict has been destructive because people start to feel that in order for me to be part of this effort, I have to change my narrative and what I believe in, which people don't have to. I mean, people sometimes accept the solution, the political solution. Historically, people would accept a political solution even though they didn't change their narrative. And I have this Croatian friend in Melbourne. He's always very passionate about Croatian politics, even though he was born in Australia and lived all his life in Australia. He spent 1 week only in Croatia, and we went to Croatian club in Melbourne. And on the entrance, he showed me the map, and he said, Muhammad, this is historical Croatia, and this is the country. This is political Croatia. This is our country, and our flag, and so on. And he has that understanding. He doesn't like it. He doesn't love that kind of understanding, or that kind of narrative, but he accepts the political price of establishing peace. And regardless of who's right and who's wrong, we are in the situation we are in. And I think there will be a political solution, but the main question is, I think the approach we're advocating for is a policy solution as well in health, in environment, in energy, infrastructure as well, in technology that we could share, which would strengthen peace and would allow people to get to know each other. We all know an agreement wouldn't achieve peace. You'll need communities to interact and to get to know each other. So our goal at this point is really to create that platform where people could interact, engage, and get to know each other. They won't necessarily like each other. I mean, Ran and I might like each other or not. Doesn't really matter
Depends.
much. We
Depends the
still
day.
do
Depends the
the
day.
job. We do it well. And I think that is what really matters the most. Even our weekly calls, we still have differences. So we shouldn't push the Palestinians and the Israelis too much to accept things that they don't really believe in order to reach an agreement. So this is more on the political side, but it's at the core of what Rozana does. It's enough to know that we're doing the work in Gaza jointly, that we're doing the work in the West Bank as well jointly. And I know this is going viral, that you will post it online as well. But that's the reality, whether people like it or not. And it's going to continue. I know people in diaspora don't like this very much from both sides, more than in Palestine and Israel. I think more people are more open to it in Palestine and Israel. So anyways, I'll stop here and I think we can explain more in the Q&A.
Great. Thank you, Muhammad. I want to actually to follow up a little bit. You've talked about all these different, you talked about some of the challenges that you have, with people basically disagreeing with each other and having these different narratives in their minds, especially even after, they meet and come together. Can you talk a little bit about those, what challenges do you see that, perhaps currently Palestinians are facing in Gaza and in the West Bank right now? And perhaps challenges that Israelis are seeing, in a way, how are they approaching this issue of, trying to address the dynamics that they're not able to bridge between Israelis and Palestinians?
Listen, to be honest, I think the main challenges that the Palestinians are facing nowadays are violent, settler terrorism and violence in the West Bank. It's a nightmare. We go to sleep thinking about it. We wake up thinking about it. We send our kids to school thinking about it. Settlers are inside the cities, villages. The other day, there was almost 100 settlers walking in one of the villages near Hebron and so on. That's getting a lot worse. And that's going to be the center of this conflict very soon. We're basically there. Every Palestinian I speak to, whether they don't want to go back to Palestine or want to leave Palestine. And I think the situation is very difficult, very depressing. Um, we're heading towards one state reality for sure. We're basically also there, which will become also a big challenge for Israel. So the challenges are many, but I think the hope for me is still within the Palestinian institutions. The main reason I still believe in a two-state solution is because of the Palestinian institutions. For you to have a state, or any nation to have a state, we need the land, the people, and the institutions. And the institutions are as important as the people and as important as the land, sometimes more important even. Because Israel had the institutions before they declared the state. And once they declared the state, they had the institutions up and running. In Palestine, there is so much pressure on those institutions, but we are making an improvement, and that's Rozana's role, is to strengthen those institutions through joint initiatives as well with Israeli health institutions.
Great. Okay. Thank you, Muhammad. Before I turn it over to Q&A, I want to pose a question to both of you. I've been reading about the Rozana's current initiatives, whether it's the community clinics that you guys operate, and the Women for Women mobile clinic program. Can you talk about those a little bit, and also what needs are these programs addressing? What impact are you seeing on the ground today with those programs? I don't know, both of you, whoever wants to begin.
I think Muhammad is.
Yes, sure. Listen, I always go back to the time when I decided to leave Australia and go back to Palestine after the war, after October 7th. And the only passport I have is the Palestinian passport. So it wasn't really an easy decision. We weren't sure when we might be stuck there with the kids as well. And I was thinking, okay, what are we going to achieve here? And 2 years forward, I can say I think the impact so far has been providing capacity building and institutional support to the Palestinian health system, providing free treatment for thousands of people. I mean, Women for Women and the mobile clinic that we run in Hebron, they are reaching areas where women and children don't have access to health. A woman could be pregnant for the whole period, for the 9 months, without seeing a doctor. A kid could get to 5 years and without seeing a doctor as well for a checkup. So we're doing that. And interestingly, we have one of the people on the call, Raghda Amr. She's a nutritionist with Women for Women. And she's the driver of the first electric mobile clinic in the West Bank as well. And they've been doing it for 3 years. And they take risk every day they leave Hebron to get to those communities because they know there are the Israeli gates, the IDF gates on the entrance of every village or city. There are the checkpoints. There are the settlers' attacks as well that might be on the road, and that's always something we are very concerned about. So providing that treatment is extremely important. And honestly, the other thing is providing 45 job opportunities for young Palestinian men and women is extremely important. Those are very young, 25, 26 years old, living in tents and working from tents, but giving them that opportunity. It didn't just transform their lives and give them hope, but their whole family. Doctors like Dr. Ala, she is one of the first people started working with us, and we told her I remember I told her, listen, we only have $500 a month to offer you, but you will be working 5 days, sorry, 6 days a week. And she would have to commute to the clinic. But she showed up every single day, and then we raised more funding, and we were able to increase her salary to pay her a fair amount. And regardless whether I stay with Rozana, I leave Rozana, there will be more people who are leading this work. But I will leave knowing that we created 45 job opportunities and treating thousands of people. And that's what I'm very proud of, but also creating the opportunities for Palestinians and Israelis to communicate. I think that would definitely create more opportunities. And that's where you'll find hope.
I hope it's not an announcement that you gave
No,
us
no,
now
no,
about that. No,
no.
no, just make
I'm
sure.
sticking around.
Make
I
sure
know
that
that's what you want, but I'm sticking around. Don't worry. I'll be around for a while.
Thanks, Muhammad. Ron, do you
I
have
must
any?
say,
Yeah.
what, yeah, I think, and the fact that we are able to provide people walking labor, like walking places in Gaza nowadays, this is a really privilege. And to see the amount or the level of people, I'm the global CEO, but I'm an Israeli and I'm based in Israel, and I see how medical teams here would like to be involved in that, like to be involved in the, somehow support the Palestinian side. They understand this is their, the moral things that they should do, but also kind of something that they feel a lot responsibility, which unfortunately many of in our side doesn't feel this responsibility. I think we should understand that it's our responsibility in our society, in the Israeli side, and to sit with people from the Palestinian side who also understand that this is the responsibility with all the pressure there is. There is a pressure in Israel against those who are active, human rights organization, different NGOs. There is a lot of pressure, but also to be the Palestinian sitting in this kind of a call, walking with Israel, it's a brave thing to do. It's not obvious. So it's something I would like to highlight as well. And our team is quite incredible doing that.
Yeah, I think Ron, that's perfect. That's a perfect segue into some of the Q&A questions that we were getting. So I'm going to kind of steer a little bit into that direction. And one of the questions that has come in was, and I'll kind of read it from the list here. How does Rozana help facilitate that trust that is necessary for an Israeli and the Palestinian to be medically treated by the other? And there's, she mentions that there's an understandable fear to be suspicious of the other side since October 7th. So I'm wondering if you can address that, you or Muhammad, both of you. You can start, Ron.
Okay, I don't know if you're going to answer directly, but our target audience when we talk about dialogue is the medical teams. For us, it's important that medical teams will work together. In the end, a patient, a beneficiary, let's call it like that, someone who get the treatment. I don't think it's so. We're not here to educate all the people that we see so many people every day in Gaza and in the West Bank getting treatment from Palestinian medical teams. Okay, they're not obviously in Gaza, they don't get it from Israeli. And yeah, our team in the West Bank doing sometimes training with Israelis, but it's not like we have Israeli doctors who treating them, although I think it won't be today we had a call about that, how we can, more do that as well. But I think it's not our role to go and, necessarily talk about it with all the people who get the treatment, but the medical team, they know we're cross-border, they know they can have, just lately we brought the Al Najah Hospital, which is in Nablus, and they are building in our new pediatric hospital to work together with Ichilov Hospital, who has a very, very famous and big pediatric hospital as well. And the cooperation there, it's what we're looking for. We're looking for this kind of building the institution, and we think we are in a important place where they can contribute to each other while they're building that.
Okay, thank you. Muhammad, do you have any other thoughts? No?
No, I think Ron articulated well. Yeah.
Great. So I'll ask another question that came in. Do you um, do you train the Rozana employees to learn basically the Israelis to speak Arabic and the Arabic speaking to speak Hebrew in order to communicate better?
We need to first learn English, I think, to communicate better. No, I think the question was about because I mentioned the ambulance driver training, and I said that part of the training is the women from East Jerusalem. They learn Hebrew, or now we don't have many, but we have, our plans are to have more doctors coming from Palestine to do fellowships in the Israeli hospital, and part of it is to learn Hebrew as well. No, we don't. Unfortunately, I must say, we don't have the same with Jewish to learn Arabic, but I think it depends on the project. If the project will, it's really depend on the needs. Because if you come to work with the MDA or you come to work in Israeli hospital, you don't have Hebrew, it's a big challenge and obstacle. But it's a good idea. I think when we're gonna have more, like in the hospital where we work, about the dialogue between the team, the hospital themselves, yes, they want, one of their needs, they say, we as Jewish Israelis, we would like to learn Arabic, and they started, internal sessions about learning Arabic. But this is, it was their initiatives. And if the project will, it will be part of the needs, obviously we will do it as well.
And just to add, sorry, we had one program called the Nursing Hub. We brought together 450 Palestinian and Israeli nurses. That was before Ran joined, until January last year when Donald Trump decided to cut USAID funding. So that program stopped there. We ran language courses for Palestinians and Israelis to learn Arabic and Hebrew. Hebrew is a lot easier, to be honest. So there's more success on that. There's more enthusiasm to learn Arabic. It's a big challenge, I can tell you.
Yeah, this is, by the way, very interesting. I just learned that someone like, I think, Palestinian politician told me when I met him 2 weeks ago that it's easier to learn Hebrew when you speak Arabic than the other way around. When you speak Hebrew to learn Arabic, it's much more difficult. I don't know
Yeah,
why.
I mean everything is kind of easier. Like in a day or two, you could start reading Hebrew. Very easy after a course. It's
Wow.
pretty easy. Yes, but no, Arabic is a lot more challenging. So yeah, but um, it's we've seen the enthusiasm of the Israeli doctors and nurses to learn.
I don't
Interesting.
want to say how many times I started to learn Arabic.
Can you imagine?
Uh,
But they don't
such a,
operate,
I'm
do
a
they?
failure. What?
Oh, interesting. Yeah, but do the Israeli doctors, they don't operate inside the West Bank, I guess, especially now Gaza, but do they operate inside the West Bank at all?
No.
No, no. But we actually in previous role, we had one doctor from Ichilov who went to, I think it was called Kiryat, to operate in a Palestinian hospital. And I think if we do this kind of things more, it will be very good because I think when, instead of bringing and get permits for medical team to come to Israel, it's sometimes easier. He went there with a nurse, with one of his head of nurse, and then they did it together. So it was kind of a training and actually really it was a surgery for a young girl. And this is something that obviously we can try to do more. Nowadays, it's much more complicated than
Yeah.
it was like before October 7th.
Got it. Thank you. So I want to, a short question here is, we talked a little bit about challenges that you have experienced or are experiencing. I guess the question is, what are you hopeful for? What do you see as something hopeful, moving ahead with the work that Rozana does, and perhaps the entire, people-to-people grassroots organizations that work to bring Israelis and Palestinians closer together, for more hopeful and better future for both people. So what do you see as more hopeful with your work specifically? Hama, do you want to start? Go for it.
Yeah, sure. Listen, I think a shift in the public thinking is extremely important to move forward. The Israeli society has shifted more towards the right, the Palestinian society as well, especially after October 7th. It's not like they were in love before, but there is, serious damage that's been done here. And I think there are two things. I think for us, we see that health is an entry point to see the potential of cooperation. And that doesn't eliminate or ignore the political rights and the changes that we need to make. And again, again, I would go back to the situation in the West Bank with the settlers. I think my hope is that at least there would be the same law applies to everyone. For example, I think that would make a huge difference. If a Palestinian kills an Israeli, he goes to jail, and the other way around. But that's not the case. I think that would be a very good start. But for us, we're trying to increase trust in cooperation through proving the impact. We're not really creating something new. We're trying to leverage the impact of health to demonstrate the impact of cooperation. The second thing, which is more important than anything else, is leadership change. We're intervening a secret when you say that both societies have leadership crisis. And without that changing, without new visions stepping in and new people stepping in to make the change that we want to see, I don't think we're going anywhere. Even if both societies fall in love with each other with their own leaders, I don't think we're going anywhere except backward and making things a lot worse. Nowadays, maybe going backward is not a very bad thing, to be honest. If we go back like 2005, which was still bad, but comparison to today, it was still good. And I think that is one of our biggest challenges. Civil society is doing amazing work, but it takes one politician to destroy everything that 100 civil society organization could build. And there is part of our, work also must be around leadership with Rozana or even outside our roles with Rozana. That's something everyone in civil society should be focused on, not trying to cover the gaps where governments fell short.
I want to take this point and say, like, I see it as, I hope that civil society will get much more stronger presence and voice because just 2 weeks ago, we've been hundreds of Palestinian and Israelis together in Paris and walking together, discussions, have the joint paper in the end. And on daily basis, I can tell you there are hundreds of organizations working together. And I hope our society will be much more exposed and the impact of ours will be inside our society much more significant than it is today, because I think our voice is not enough. It's not like there is no anyone who, like, there is no attention to that. We're very soon will go to, hopefully, to elections in Israel, and I don't see, except of very left like the Democrats, but I don't see any candidate one of the candidates to the prime minister actually speaks about his vision with the Palestinians. It's more of the same. It doesn't go from Netanyahu to Bennett, Eisenkot. Nobody says something positive about that. They're all afraid from bringing a vision. And this is something that I really hope will happen. And the civil society, we have a very important role pushing for that direction. And second thing, which is much more, in our Rozana, nowadays the Palestinian health system is actually rely on the Israelis so much and pay a lot of money and in depth because of referrals of people. And I would like to see in a few years that actually we hope the Palestinian health system to be much more independent, no needs to refer patients to the Israeli system first, because for the patient it's not good, because they don't have the treatment in Palestine or they don't have the knowledge how to treat. So I hope we will be able much more independent health system in the Palestinian side. And I think if we'll do that as Rozana, it's good enough. And then yes, Muhammad, then you can leave.
Thank you. Well, and the hope. So basically, you're talking about the hope. Following. We know Israeli elections are coming up. you both hope for, kind of a shift in the mindset
We're
of
not we're not political
correct.
organization, but you can guess that we probably want a
No, but you
change.
hope
Yeah.
for a shift in in the mindset of our political leadership, both Israel and in in the Palestinian government as well, um, just to encourage and support organizations like Rozana and others that do the work that you do. Um, Great, and I want to actually end with one more question here. We're representing here the Greater Washington community, and I'm sure there are other communities around the U.S. that also are very interested in your work. And what can communities like ours here in the Greater Washington area do to support your work, both here perhaps in the U.S. and in Israel and Palestine as well?
First of all, I think this exposure, it's very important. I think it's important for us that more people will know about what we do and more people will believe that actually it exists and don't give up on us. Don't give up. I know the new Jewish generation in the US a little bit fed up with Israel, gave up and doesn't want, and we're not our government. We're not our politicians. And there are many, many people who believe that we can live together, we can have peace, we will reach that point in the future, we'll stop the occupation and have dignity to everyone to live together. So this is something that I would like you to remember, not to give up on us. Rozana is still a relatively small organization. We have much more room to expand our work, and any kind of support will help us as well. And last thing, and this is more in your hand, I don't know how you can change it, but for example, I can come to the US and, I lived there for a year last year. I've been in, very close to where you based. But Muhammad can. Palestinians cannot come nowadays to the US. And I think it's a miss of opportunity. I think should be more pressure there to allow Palestinians to get visas to come and speak and meet. And when we come together, you will see it's not just we speak over Zoom, that we can actually create more, I think, mobilize more change.
Thanks on it.
Absolutely. Thank you, Ron. Um, Listen, I think for us, this is a very important platform. And I think a joint initiative where we could both leave an impact is extremely important. As I said, we started the field clinics and then we added rehabilitation. Now we are looking for the mental health project for kids in Gaza. And that's an area I believe we could cooperate in and make it happen to reach thousands of kids in Gaza and make a difference in attitude, in thinking, and providing the education that they don't have access to. So it's not just mental health support, but also an educational aspect for the work that you are trying to focus on. And I think that's an area that we could also discuss later, Adam. And I think being here and being open to listen, even though I know sometimes it's not so easy, even though we're in like very controversial as well. There are a few elements that are controversial there we might disagree on. But as I said before, the way we work even with Israel or within the team itself, we've been able to make the impact and the difference despite the political differences, not because we don't have political differences in the first place. And this call that really gives platform for also a Palestinian here, and as I said, Ragda as well on the call. It's very important. Thank you.
Yeah, Muhammad Khan, I want to, I can't thank you both enough for, sharing both your experience and about the important work that you both do at Rozana. And, this conversation, I think, reminds all of us that even during, periods of challenges that you guys spoke about, there are organizations and individuals who are committed to improving lives and building relationships and creating opportunities for cooperation. And these efforts, do not always make the headlines, but they are, essential to the long-term work of building a more peaceful future in the region. So I want to again thank you both, and I want to, end this webinar by also inviting all our viewers to visit our, Greater Washington Partners for Peace webpage. It's on the JCRC website, and you can learn more there about all of our partners and information about the initiative that we have. This page can be found at jcouncil.org under the Israel Action Center tab. Please stay tuned for further programs, webinars, and hopefully you will have Ron and you, Muhammad, here in the U.S. and host you together for a conversation with our community, and that would be amazing, I think, for all of us to be there with you
Inshallah.
in person.
Inshallah.
So again, thank you all for being here, Ran, Muhammad.
Thank you very
Thanks
much,
so
Adam.
much.
If we didn't answer part of the question, feel free to just forward me the email, and we will address everything.
Great.
Okay.
Yes, I will definitely do that. I will forward you questions that we did not get to. So I appreciate your time, and thank you so much for being with us.